So today, I'm announcing a new package of measures to ensure transport boosts our national response to Covid-19. First, we're announcing a far-reaching package to safeguard the flow of essential goods into and across our country. I can announce the government has secured a trilateral agreement along with French and Irish governments, which commits our nations to keeping freight routes open throughout this crisis, bringing in life-saving medicines, food and many other essential goods, allowing us time to meet the needs of our countries during this difficult period. Operators on many of these routes have been under rising financial pressure due to falling demand, since many of them bring in crucial goods like medicines, raw materials, and chemicals to purify water. It is important to guarantee the continuation of these services. I've also given the green light to trials of drones to deliver medical supplies. Earlier this year, we awarded £28 million to Southampton and Portsmouth to deliver a future transport zone. As part of that initiative, £8 million was earmarked for testing drones and how they might be used to deliver goods in the years and decades ahead. Of course, now we have an urgent need, so we're making use of that testing programme as part of our response to Covid-19. As a result, I fast-tracked trials to begin next week to carry medical supplies and equipment to St Mary's Hospital near Newport on the Isle of Wight.
Importantly, the curve is flattening, which I think indicates the reduction in cases and transmissions, but just with a little caveat as we go forward, with the increased numbers of tests available, and that's particularly in Pillar 2, that's the orange colour on the slide, we will expect to see, in some ways, an increase in cases because we're having an increase in detection numbers. So this is a good signal. We are flattening that curve. It rose sharply and it's levelled off. But don't be surprised if cases do increase a bit as our actual testing increases as well. So I wouldn't have a specific message to Donald Trump. I'd have a specific message to anybody who suggested they should be injecting anything into their bodies. I mean, clearly, we would not support, from a medical professional perspective, it is really important that people use appropriate treatments that are evidence-based and tested.